Hello and thank you for watching. So I'd like to share with you today a new approach in psychotherapy, acceptance and commitment therapy or training. An interesting blend of Western science and Eastern philosophy, deeply rooted in Western science but also steeped in Eastern wisdom. Acceptance and commitment therapy, or ACT, is a highly effective form of therapy or training. It's rooted in the reality of what it is to be human in human nature through evolutionary science. ACT shows us how our automatic problem-solving nature, our autopilot reactions entangle us in such a way we have the very sincere intention of seeking relief from our internal struggles, uncomfortable thoughts and feelings. However, this automatic reaction, the autopilot, unexamined self, adds fuel to the fire. So you hopefully or probably have heard the saying, what you resist persists. Let's examine how that might apply in your own life. So why do humans find it so hard to be happy? We all have our needs met materially, yet the majority still feel unhappy and dissatisfied, even though our basic needs are met. And this is dissimilar to any other animal species. So why is that? So through a scientific approach based in evolutionary science, how language and the way that the mind has developed through using language, how that capacity for language means that we are different from any other animal. So the ability to think is a great gift, but language in our head, our thoughts, are the things which frequently bring us away from the present moment. We will continually ruminate about the past, worry about a future which may never even come to pass. Language and thought allows us to not be present. Our thoughts can and frequently do drag us away from the current context. So the mind through language categorizes experience into good or bad, right or wrong, desirable or undesirable. And it's useful to begin to notice that in the absence of this judgment, in the absence of labeling, it's more simple than that. A feeling which is not bad in itself has arisen. It may be uncomfortable, but it's not something that I must be rid of. If I can learn to take this approach, which is one of allowing as opposed to resisting, I don't then add fuel to the fire. I don't turn pain into suffering. So I would say in my experience, one of the commonest goals described by people in therapy is I want to be happy. So this desire, this frequent goal, I would say suggests that the human default position in a lot of people's minds is one of happiness. But happiness, like all our feelings, is impermanent and transient. It comes and goes. So to seek to hold on to happiness is doomed to failure, can only lead to dissatisfaction. However, this is sold to us in the Western world, and a whole number of lucrative industries, one amongst them being the pharmaceutical industry. A numerous amount of industries have evolved to assist in our quest for happiness. However, psychological pathologies and disorders, human unhappiness is ever growing. The rates of depression, anxiety, stress, self-harm, suicide are all on the increase in industrial nations. Why is that? There is something in our makeup which has the potential to cause great harm and suffering. So many Eastern wisdom traditions have pointed to that fact, that it's not external circumstances that creates suffering, it is our interpretation, it's what happens on the inside, and that ultimately is something we have great power over. So great wisdom traditions over thousands of years have pointed to the ways the human turns the pain of life into suffering. So it is something that ACT also embraces, and why I believe, partly why it's got something very important to offer, not only those who are struggling with emotional difficulties, but for anyone, any human being who's interested in self-awareness, self-knowledge, self-acceptance, and understanding what this life is about, what this sacred journey of this life is all about. I think ACT has some very important life skills, lessons, awareness for everyone to benefit from. So ACT takes apart the assumption of, happiness being the healthy normality. It sees that as very problematic. So mainstream psychology through the DSM, the Diagnostic and Statistical Manual, shows symptom lists of different disorders. So it focuses very much on description of symptoms. However, describing symptoms often misses what's maintaining a problem, and without that knowledge, effective change simply cannot happen. So simply describing symptoms is not helpful in psychology, and ACT takes a more functional and contextual approach. So one thing we all like to do as humans is avoid difficult experiences. Anxiety, embarrassment are sorts of emotions we feel we shouldn't have. They're uncomfortable, and the problem-solving mind will try to, following the judgment that this is bad, will seek to get rid of it. So a chain of events is set off in an attempt to get rid of those internal experiences. So a common response when we experience them is to try to squash them or push them away. So this is the same with negative thoughts. I'm not smart enough, I can't do this. 80% of people when asked said they will try to distract themselves from those kinds of thoughts. So suppress them. Suppression, the more I try not to think something, the more I'm likely to think about it. Escape, avoid, suppression. These all have a rebound effect. So if I'm grieving and I attempt to not feel that grief, then those feelings of grief and bereavement will stay for longer. Worry, a common response to anxiety to try and gain certainty and control. Worry increases anxiety. Isolation and withdrawal increases depression. So ACT helps people to stop seeing their thoughts and feelings as something they need to change or avoid, and to focus instead on valued living rather than attempting to control or avoid thoughts and feelings. To begin to strengthen our awareness, to notice the automatic self in flight, to strengthen the observer of these experiences, and therefore create just a little bit of space between the automatic self and the awareness that notices And that awareness often is enough to begin to dissolve those old patterns. So ACT can strengthen our awareness of these old patterns, these old programs, and begin to relate to the world based on our current circumstances and conditions. We can help people to begin to recontact their present experience, which has been shown to be positively associated with well-being. The more I can do that, the more my life has meaning, purpose, and we would experience that as a positive state of well-being, more correlated with self-confidence, self-esteem, self-regard. And ultimately, mindfulness is at the very root of ACT, strengthening this awareness of this automatic self. And that is the miracle of mindfulness. So very normal human processes have a destructive quality to them, and if we don't don't learn to interact with them differently, they have the potential to create a great deal of suffering from the pain that is a part of life. So the human mind evolved to categorise, predict, evaluate, judge, and we constantly compare ourselves to others. We can, through language, create an ideal vision, an ideal self in the mind's eye, and criticise ourselves for not living up to that. We're programmed to be on the lookout for signs. I'm not fitting in. I might be rejected by the clan. We're trained through evolution to be fearful of change, and this fear, which is often unacknowledged, when it's unacknowledged, it often restricts our behaviour and can put us off from exploring new opportunities. So if I do that, pain will come up as which is a byproduct of avoiding a life of meaning, fulfillment, which involves embracing change and uncertainty. If I don't take those opportunities in life, pain comes up to warn me that I'm off course in life and I should adjust to stop me crashing onto the rocks of life. So we developed language because we're a cooperative species, so language enables us to interact with others. It allows us to minimise external threats, but we have over-applied on autopilot this tendency, which is to see our external experiences as problems that need to be solved. I am a great problem solver as a human being. That is our specialty. We don't have strong teeth and claws. We've got a problem solving mind. So that problem solving approach through language, through our thoughts, is often inappropriately applied, which turns pain, which can be borne, into suffering, which often can be very difficult to live with. So to try to minimise or control our internal experience is ultimately what's being done on autopilot in a sincere effort to seek relief. That reaction adds fuel to the fire. So to try to minimise or control our internal experience, that's termed experiential avoidance. And experiential avoidance is defined as trying to change the formal frequency of an internal experience. Avoiding our internal experience to try to not have certain experiences, thoughts and feelings has been shown, is known to be the most toxic process in psychology. And we have many strategies to try to avoid or control certain thoughts and feelings. So if anxiety shows up, which will, it is a part of life, we might try to avoid going to certain situations where anxiety might show up. We might procrastinate, seek reassurance from others. We might worry, dwell, avoid. We need to begin to look at the function of any behaviour, and if I'm doing these things solely to try to get rid of an internal experience, this is maladaptive and often destructive. Sadness is not a problem unless the mind says so. So if sadness shows up following the judgment that this is bad, lightning quick this happens, change efforts are then employed, a chain reaction is ignited in me. Change efforts are employed, problem solving mind with its endless commentary. Why is this happening? Why am I like this? When will this go away? The mind on autopilot will focus on a particular viewpoint, a story, a perspective, and hang on to that, cling on to that. See, this is the cause, my partner, my job, my parents, my history. Who knows what the real cause of our feelings? Feelings just show up. We could be resonating with the vibration of a feeling from a catastrophe that's occurring on the other side of the earth. Or we could be resonating with the vibration of the neighbours arguing. We're picking up on that. I don't want to be spending my time trying to control or remove an internal experience. I want to be moving my life forward towards a desired outcome, and obviously with skills to handle the journey. You know, we can't choose what we feel, but I can choose how I behave. So ACT likes to use metaphors because what we're trying to do is often bypass the thinking, problem solving mind, and metaphors or analogies can help us to achieve that. So the polygraph is a analogy used. Imagine someone sat there with, you're hooked up to an electric shock, a piece of equipment that can administer an electric shock. Someone says to you, I don't want you to feel anxiety, so just don't feel that. And if you do feel it, I'm going to give you a very powerful, painful electric shock. What would be our experience? Yeah, trying not to have anxiety is enough for me to be anxious. What I don't want, I'm likely to have more of that when I judge that as undesirable. I add fuel to the fire, and ultimately I'm not able to control my feelings. We can't choose what we feel, but I can choose how I behave. So ACT is deeply concerned with the function and context of behaviour as opposed to just the description of symptoms. So that's term teleology versus etiology. So we want to begin to take a more of a functional approach to human behaviour when that behaviour is unhelpful or maladaptive. So the DSM approach, the mainstream psychology approach of listing symptoms, doesn't help us to identify the function, which tells us a lot about what's maintaining the behaviour. If we want to understand and intervene to reduce or increase a behaviour, we need to understand the function of a behaviour. So maladaptive behaviour is maintained, 1 for attention, 2 for avoidance or escape, 3 it stimulates the person in some way. So we look more functionally at maladaptive behaviour. And we also need to look at the context in which the behaviour is occurring. So we're not so interested in the description of symptoms, we're trying to understand what is this behaviour in service of. And once we understand the function of a behaviour, we can target change efforts more effectively. So if you ask a child to tidy up their toys and they throw a tantrum, if we can understand what is the function of that behaviour, so it could be to gain attention. Yeah, it gains the parent's focus and attention, even if it is for a negative reason. It might serve as a way to avoid doing the task. The child doesn't want to tidy up, so it throws a tantrum in an attempt to try and avoid doing that. Or it stimulates the child in some other way. If we want to change the behaviour, the tantrum, then understanding what that behaviour is trying to achieve, we can then target that for more effective change efforts. So if the child is doing it for attention, then we need to extinguish the fact that we're giving attention when the child is exhibiting negative reactions. We need to turn off that response, therefore not reinforcing that behaviour. We will in time extinguish that behaviour. We want to reinforce good behaviour. So understanding the function of the tantrum makes us effective in changing that behaviour. So once we understand the function of the behaviour, we can target change efforts much more effectively. So taking this approach, when anxiety shows up, very quickly on autopilot it's evaluated as bad. I want rid of this anxiety, I don't want to feel it, but it's there. It is as it is. So if you don't want it, you're having more of it than if you took a new approach to it. So this new approach is about expanding and allowing, rather than the habitual struggle and resistance. And it's in that struggle and resistance to internal and external experiences which creates the problem, not the internal or external experiences themselves. So the feeling of anxiety is an internal experience I'm having. It's here. If I interpret it as dangerous or threatening, if I label it in that way, judge it as bad, I start to fear having it, then it becomes much more toxic for me and comes to a point where it will begin to control my behaviour. So the more I try to control my internal world, the more narrow my external world becomes. So there will be things I can't do in the outer world when my focus is on controlling my thoughts and feelings. Yeah, I will avoid going to busy, crowded places. I will take my friend with me. I will wear my earphones, distraction, avoidance. That is an attempt to control my anxiety, focusing on change in that way, controlling my behaviour in an attempt to control my thoughts and feelings, obviously narrows my external world. So a new approach is to become one aware. There is nothing wrong with the feeling being there. Anxiety is a part of the journey. I don't need to take this personally. Thoughts and feelings simply appear by themselves. And 3, all feelings come and go. So why give so much attention to what I don't want? So the model of psychopathology considers 6 core processes and targets them for awareness and change. So Jane fears the judgment. She fears the judgment and the rejection of others. So Jane is frequently entangled with a conceptualised self, thoughts in her head, a story. I'm shy, I can't do small talk, people think I'm boring. With this conceptualised mind dominated, rule following, constricting sense of self has a very past and future focus. So I'm away from the present moment. So Jane feels very anxious in social situations. She doesn't want to feel that anxiety, so avoids socialising as much as she can. Jane also dwells and worries, tries to think about this a lot of the time, as she's often alone. She doesn't go to parties, avoids friendship, lives alone, stays home alone most of the time. So when she does rarely venture out of the home and socialise, it's rare, it's uncertain, it's new. So Jane therefore feels very rusty, out of practice. This all increases her anxiety. So furthermore, also consider as Jane lives alone. She's got few friends, she rarely socialises, she feels totally rejected, the very thing she feared most. So you can see that vicious cycle in action. So the new approach, rather than trying to control anxiety in all those numerous ways through thinking and behaviour, well established habits, the new approach is to become aware of what is ultimately being resisted. The possibility of rejection in relationships inevitably creates fear. I might make a mistake. It's uncertain, it's unknown. Change efforts are employed on autopilot to get rid of the uncertainty and the fear. So we want to learn to become aware of this continual commentary about experience. What are those thoughts in the service of? Does getting hooked into this kind of story help me in any practical way? Or is it simply demoralising? Does getting hooked into this story represent an away or a towards move? So anxiety is a part of life, it's a part of interpersonal relationships. There's no need to fix or change anything. This is the new approach. Wanting to change it means I have more of it. I can learn to approach anxiety differently and therefore not allow it to overwhelm me and restrict my behaviour. So we're going to learn to become aware of what we're habitually resisting. I'm having the thought that, creating a little bit of distance. So the ACT model has 6 core processes to be able to recontact our present moment experiences and begin to move in a valued direction with skills to handle that journey, the pain that comes along our way. So 1, we're going to be more connected, mindful, have a more present moment here and now, noticing thoughts and feelings in the here and now as they arise, not as the mind says they are. 2, a huge part of the model is clarifying my values rather than trying to control my thoughts and feelings, to be guided by what matters to me. So connection with values gives me direction and a compass heading in which to follow in life. 3 is committed action. So behavioural activation, how can I bring that value to life every day, taking one step and then another. I walk for the rest of my life. These represent towards moves. 4, a healthier self-awareness, the ability to take perspective. So perspective taking, rather than looking through thought at its evaluative judgments, I can notice an evaluative thought. I'm having the thought that I'm not good enough, creating some space between the thought and the awareness that notices it. And from that place, that's a more grounded place from which to interact into the world, a much more secure space, connecting with a more solid, unchanging space that exists within us, rather than being identified with the fleeting form. that is impermanent, ever changing. So as you've no doubt gathered, watching your thinking is a really big part of the ACT model. So when we stop and begin to notice and watch our thoughts flow, we notice our minds are constantly thinking, and that's fine. They are there, but they also have enormous power to suck us in, and we routinely believe our thoughts, this perspective that we have arbitrarily just clung on to, constructed a story, our history, who I am, believe that perspective. And that is a very restrictive place in which to interact with the world. It's baggage that weighs us down. So the ACT model helps us to see that thoughts fluctuate. They are very context dependent. The context changes the thoughts that show up. So I'm having the thought that I'm not smart enough, not I'm not smart enough, creating distance to learn to see thoughts as just thoughts. 5, we want to expand and open up, acceptance, learning how to just be with our thoughts as the physical, bodily sensations that are showing up right now. If anxiety shows up, the mind will try to work out why or how to get rid of it. I'm entangled in my thoughts about anxiety. I've been taken away from walking in line with what I value. These represent away moves, so ACT wants to promote a more flexible approach, which is psychological flexibility, to interact in the world based on current circumstances in a more open, non-judgmental, so away from the mind's judgments, without that labelling, to be more open, non-judgmental, curious about the world, to interact in the world in a way which is consistent with who I want to be in the world. What value do I want to bring to life in this moment, as opposed to trying to control or avoid our internal events. And by doing that, our external, outward world becomes more rigid and narrow. So the model wants us to open up, to be much more flexible in how we behave. My emotions are not reasons for my behaviour. I've got an interview which makes me anxious. I might talk myself out of why I don't want to have that new job. Yeah, I talk myself out of it. And we would then come to believe our reasons. When we think our reasons cause our behaviour, we're missing a vital piece there with reasons. We behave, but our reasons don't cause our behaviour. And this is important to understand when our behaviour is maladaptive. So ever since childhood, I've been asked to give reasons for my behaviour. Why did you hit your sister? Why are you late for class? The team meeting? We have to give reasons. We become entangled with those thoughts and come to believe our stories. We then think our reasons cause or justify our behaviour. I didn't get out of bed today because I'm depressed, and we believe those reasons. That becomes a very restrictive story. There will be instances, however, when we felt depressed and we still got out of bed. Yeah, our reasons do not cause our behaviour. How we choose to behave is our response. So, number 6, watching thoughts to get enough distance from reasons, stories, thoughts. What matters to me in this situation is more what dictates my choices at any given time. And when I'm choosing to behave, there are away moves, what takes me away from what's important, and towards moves. So away moves are not wanting to think or feel something. Towards moves are about moving towards my value, what matters to me in this situation. Despite the pain that's part of that journey, and having some tools to take with me along the way. So learning to become aware, noticing our automatic reactions is often enough. Noticing if what you resist persists, if that's true, the opposite also applies. So what you allow dissolves. Negative states, what's deemed negative by the autopilot self. Negative states persist because we give them all our focus and attention. So when we begin to allow what is to simply be there, when we offer no resistance, it withers and fades. And even if it doesn't, it's okay to just be there. So this is the acceptance and commitment training approach. Thank you for watching today.